Welcome to the COPD Foundation's COPD Advocacy Training Webinar. We appreciate that you've chosen to spend time and to learn more about advocacy and the COPD Foundation's advocacy program. Advocacy serves a number of purposes, ranging from educating our government to empowering individuals affected by COPD to make sure that their voices are heard. Living in a democracy, our government seeks input from its citizens to drive policy. The COPD community depends on people like you to come forward and make their voices heard. Being an advocate means you represent the millions of Americans with COPD. I'm Miriam O'Day, and I'm the Senior Director of Public Policy, and we look forward to going through this presentation with you today. So, what do advocates do? They recruit, educate, speak out, mobilize, react, and empower individuals. We need you. If the COPD community doesn't speak up for itself, then who will? One of the greatest challenges facing COPD advocacy is a general lack of awareness and knowledge about COPD. Only half of the 24 million individuals who are living with the symptoms of COPD have been diagnosed. That means there's another 12 million Americans that are walking around with COPD that don't even know it. As a COPD advocate, it would be your mission to help us identify the faceless millions through awareness campaigns, through contact with your elected officials, by writing to your local newspapers, and more. COPD is now the third leading cause of death, and it reached the third leading cause of death 12 years earlier than was originally predicted. This is not good news. By becoming an advocate, you're pledging to help the COPD Foundation get these numbers down. We're going to do this by pursuing increased research funding, advocating for access to care and fewer cuts to Medicare, and improved awareness efforts. COPD is a national health problem. It affects all 50 states, which is why we need action on both the federal and the state levels. COPD costs the government approximately $49.9 billion. That's in 2010, and it's only going up. By focusing on prevention and proper disease management, we hope to prevent unnecessary health exacerbations and hospitalizations. Those are some of the most expensive costs associated with COPD. COPD is also costly to employers, both in terms of insurance costs, disability, and days lost from work. In fact, COPD is the second leading cause of disability in this country. COPD forces thousands of people to increase their reliance on Medicare or disability and decrease their quality of life by limiting their activities. With government help, we can build COPD awareness and encourage that the disease be addressed appropriately. This chart shows the direct relationship between federal disease funding and mortality rates. As you can see, as the federal dollars and the federal investment goes up, disease mortality goes down. As an advocate, you'll be actively asking your elected officials to consider this important relationship and provide increased funding for COPD and COPD research. The ultimate goal of our advocacy efforts here at the COPD Foundation is to inspire a coordinated federal response. We want to address the national health problem that is COPD. We want government agencies, all of them, Congress, CDC, Medicare, the National Institutes of Health, and more, to work together to address 8 categories in COPD. Those include legislation, data, prevention, awareness, education, treatment, and research. But in order to achieve a coordinated federal response, we need to target all aspects of government. This is where you come in. Let's talk a little bit about Civics 101 and how to navigate the federal government. You know, lobbying is a democratic tradition. It's protected by the Constitution. You're given the right to petition the government. A democracy values input from its citizens and advocates like you. Members of Congress are elected by you to represent you. You should never forget that. You're a COPD expert. That's something you also should not forget. It's up to you to make members of Congress aware of what it's like to live with COPD and address COPD on a daily basis. In order to advocate successfully, you need to understand a little bit about the federal government. Congress is made up of two chambers, the House of Representatives and the Senate. The House has 435 members that represent all the congressional districts across the states. Those individuals are elected every 2 years. Senators, there are 2 from each state, are elected every 6 years. Both senators and representatives have offices in Washington, D.C., but also back home in the district near you. These offices are filled with knowledgeable staff who can discuss the issues and will often be your primary contact. Congressional offices are normal offices. There's nothing magical or mystical about them. Usually a receptionist sits out front and the staff work in the back. Most of the staffers are young, and many of them may be from your district or your state. So if you're visiting them here in Washington, that's a great icebreaker. Building good relationships with the staff is often the key to success. They have the ear of the boss. So get to know all the people that you interact with, because they will become your best allies. And never forget that all politics are local. It's not what you know, it's not who you know, it's what you know about who you know. Never forget to make it personal. Whether you're writing a letter, speaking on the phone, or visiting in person, never forget to explain who you are, who you represent, the purpose of this correspondence or visit, and ask for what you want. It's also important that you understand who's on the other side of the table from you. Take a minute to understand your member of Congress and the role that they play before you speak with him or her. What committees does your member serve on? Have they shown support for COPD issues in the past? Are they on the COPD Congressional Caucus? What role does this member serve in Congress? How things get done in Washington. The political process can seem a bit daunting, especially at first. But once you understand how some things get done, you'll be able to know who to ask, what to ask for, and how to ask for it. Here are a few tips. Members of Congress can form a congressional caucus to help pass legislation and to raise awareness and show support for certain issues. We're very fortunate in that we have great congressional leadership who have formed the Congressional COPD Caucus. Members can write Dear Colleague letters, and those are circulated all over Capitol Hill, and they build support for a specific issue, ask members to co-sponsor legislation, or can just raise general awareness. Once Congress passes a bill, it's up to the federal agencies to implement the legislation, like the Department of Health and Human Services, who does so by rulemaking. So we often ask our elected officials to write to them to clarify the intent of Congress in the law. We can also call for reports from the Department of Health and Human Services or the National Institutes of Health to understand more about what they're doing to address our concerns and to start talking about how they can do more. Resolutions are also often passed by Congress, and they express the sentiment of either chamber towards a specific issue. Resolutions don't require that they be approved by both chambers or that they're signed by the president, and they don't have the force of law. But for instance, in 2011, the Senate passed a resolution proclaiming November as COPD Awareness Month. As important as what you ask for is who you ask. It's important to seek out people who are in a position to help you. First, Congress is broken up into committees. This way, individuals, while they may know a little about a lot of things, can specialize in some things and to focus their workload. There are authorizing committees that have jurisdiction over our issues. Some of those committees include the Senate Health, Education, Labor, and Pensions Committee and the House Committee on Energy and Commerce. There are also appropriations committees that control funding. These are some of the most powerful committees in Congress. We work both with the House and the Senate appropriations committees to make sure that they're concerned about issues that affect COPD when they're making decisions about federal funding. Committees can hold congressional hearings to discuss legislation. At these hearings, we often submit a written statement. Sometimes they ask for experts to speak on the issues. Sometimes, more often on the state level, patient advocates may be asked to speak at a hearing, and this gives us a great opportunity to have our voices be heard. Even as an outside group, the COPD Foundation can host congressional briefings, which we've done frequently in the past. These briefings bring staff, legislators, sometimes federal agency heads, patients, and other experts together to discuss the issues and build relationships. The appropriation season is one of the busiest times on Capitol Hill because everyone is seeking a piece of the budgetary pie. On the first Monday of February, the President submits his annual budget, and February through late March, Congress holds hearings, members consider appropriations requests, and constituents discuss where they think the money should be spent. Everyone is talking about dollars and cents during this time, so it's expected that constituents will show up and ask for funding. In fact, legislators want your input. You're the COPD expert, which you should not forget, and you can tell them exactly how federal dollars are or are not working. The Congressional Budget Office, or often just referred to as CBO, is a nonpartisan government agency that evaluates the federal government's cost for all legislation. Oftentimes, when you're discussing legislation, you may hear the member or staff ask if CBO has given it a score. The CBO score is the evaluation of what this piece of legislation will cost if it's implemented by the federal government. Any legislation that is taken seriously and is under consideration will have a CBO score. With the ballooning deficit, how much will this cost is often one of the first questions on everyone's lips. So now that you know how work gets done in Washington, how can you insert yourself in that process? Here are some ways that you can get involved. The COPD Foundation issues action alerts, and we'll talk a little bit more about that. We communicate on a grassroots level, but we also communicate on a grass tops level to our state advocacy representatives. We have partnerships and coalitions. We have data, and data is being collected now that will be very important to advocates moving forward. Federal reports. You can always attend a town hall meeting in your state. State proclamations, federal resolutions, advertorials, social media, advocacy days, Capitol Awareness Days, and always make sure that you follow up, follow up, follow up. These are a few of the tools in our advocacy tool chest, and the COPD Foundation and its staff will be more than happy to discuss this with you if you're willing to get involved. So, how can you be an effective COPD advocate? First of all, we understand that there's a hierarchy of advocacy, and that people may not want to get involved at the highest level when they first start becoming an advocate and start learning about our process. So, our advocacy strategy welcomes all levels of involvement. Are you unsure if advocacy is for you? Then you could start small. You can visit the COPD Action Center, and we'll talk more about this later. You can send a pre-written letter or email to your senator or congressman or congresswoman and ask them to join the caucus, or you can make a telephone call and talk about the importance of COPD. You want to do even more? We would encourage you to become a second-tier advocate. You can also use the COPD Action Center to send emails and get involved with spreading the word in your local community by sending letters to the editor or talking about COPD and COPD advocacy on social or earned media. And finally, at the top of the pyramid, these advocates take part in activities of the first two groups, but they also participate in congressional district visits, attend town hall meetings, have regular interactions with their elected officials, and participate in the COPD Foundation's advocacy activities on a regular basis. These champions are on the front lines of COPD advocacy and are often the people who become our state advocacy captains. The COPD Action Center is the cornerstone of our advocacy strategy. On the Action Center, you can learn more about current COPD legislation, find your elected officials, sign up for action alerts, and send messages to your representatives, all in one place. The Action Center serves as a platform to mobilize, allowing the COPD Foundation to quickly alert our advocates when we need them and we need them to reach out. The Action Center also makes our local efforts possible, allowing us to target state-specific action alerts. We can find local advocates for district visits and locate advocates in districts that have key committee members or members who are leadership. Action alerts are set up to notify our advocates about pending COPD-related legislation. Whether on the federal or state level, you can join the COPD Action Network to receive action alerts in your inbox. You can take action by clicking on the alert, and this will take you to a new page with a brief summary of the bill and why it's important to the COPD community. There's a pre-written letter there for you to send to your member of Congress. Of course, we encourage you to personalize the letter by adding your own story and inserting your own letter, or you can send it as it is. Depending on the action alert, your letter can be sent to your senators or representatives or elected state officials. Just fill out the form below the letters and click Submit. It's as simple as that to contact your elected official and stand up for the COPD community. To explore more of the COPD Action Center, scroll past the action alerts to find your elected officials, learn about upcoming elections, you can even register to vote, and check out the latest legislative calendar. Remember, whenever contacting your elected officials, that they are elected by you. And when interacting with members of Congress, remember that you not only represent yourself, but also your caregiver, your family, the entire COPD community, the individuals you serve, and all of the voters of your district. One of the easiest ways to contact your elected official is via telephone. The Action Center has the phone numbers for all of your elected officials. All you've got to do is click and put in your zip code, and it will tell you what to do next. Whenever calling your elected official, be prepared to give them your name and address first. This establishes that you're a constituent. Then tell the aide that you're talking to that you'd like to leave a brief message, such as, please tell Senator or Representative Smith that I support or oppose the name of the legislation. Give the aide a couple of reasons why you support or oppose the bill. The more specific you are, the easier it will be to relay your message. For more tips on calling your elected official, there are places on our website that you can visit called Issues in Legislation or Capitol Hill Basics. In-person visits always make the most impact with members of Congress and are typically some of the most successful lobbying strategies. Your representatives and his or her staff are willing to meet with you both in Washington, D.C. and back home in the district office. A district meeting makes an in-person meeting very easy with a minimal amount of travel. Usually their offices are set up in a convenient location, like next to a shopping center or in a local office building. It's also a great opportunity to start building relationships with your elected officials and his or her staff person who handles healthcare issues for them. Meetings with your elected officials can be a bit daunting at first, but if you follow 6 easy steps, you'll be prepared, confident, and ready to ask for what you want. Step 1. It's important that you decide your goal. The people you meet with will want to do something about what you're talking about. When you tell them your story, they will want to take action. So be prepared to tell them directly and concisely. Know what they're capable of doing and how they can help you. Is this the health legislative assistant or the scheduler that you're meeting with? Know what actions you have in your toolbox, what other ways you can gain support for your cause, or how you can show support for something that they're engaged in. And always remain open to suggestions. Step 2. Identify your partners. Teamwork can be key in capturing the attention of Congress. If you're going to a meeting, consider bringing a teammate or a small group, but usually no more than 4 people. You need to decide in advance what each person will say and then practice together. You'll be much stronger as a cohesive group. Also consider a network meeting that includes several different members of the COPD community, such as respiratory therapists, maybe a pulmonologist, or a caregiver. Don't be afraid to think outside of the COPD community as well. Are there issues that affect multiple chronic conditions? Is there a reason to be fighting together? Consider having a meeting where you include other chronic disease states. Step 3. Identify congressional targets. Are you targeting authorizers or appropriators? Is this person a member of the Congressional COPD Caucus? Are they a member of congressional leadership? Are they from your state or district? And remember, you can always view all of your representatives from your state as a delegation. While your specific representative may not be on a committee of jurisdiction, they may be able to talk to a colleague within the state delegation that is. Step 4. Develop a clear message. Know what you want to say before you get there. Prepare, prepare, prepare. Learn a little about the person that you're meeting with. What committees do they serve on? Have they supported COPD-related legislation in the past? Are they a caucus member? Know what you want to tell them. Prepare some talking points. And remember to call us here at the COPD Foundation if you need some help. Plan ahead. If your group is going in together, make sure that everyone knows what talking points they're going to cover. And always be specific. Tell them exactly what you want and how you would like them to take action. Step 5. Keep the appointment. Be on time, introduce yourself, and thank the legislator for something, a vote, a speech, an action, their support. Tell them why you're there and make it personal by telling them your own story. For instance, the problems that you face and challenges living with COPD, how you received your diagnosis, or how it affects your daily life, your medications, your access to care. Keep an eye on the time. Most congressional appointments are usually assumed to be about 15 minutes. You should establish when you arrive exactly how much time you have, and then respect the time allotted for the meeting. Keep it brief and to the point. Your member and their staff will greatly appreciate this. Step 6. Follow up, follow up, follow up, follow up. This is one of the most important and often overlooked steps. Follow-up is key in building relationships. The most common follow-up from a meeting is a quick letter or an email to the legislator or their staff thanking them for the meeting. And remember what was said at the meeting. If you promise to do something, do it. Prove that you're reliable and credible. Believe me, they'll come to rely on you in the future. Finally, tell everyone. Tell your friends and family. Call us at the COPD Foundation. Post information on Twitter. Post it on the COPD Foundation's Facebook wall. Get the word out and encourage others to follow your lead. Ask your friends and family to visit the COPD Action Center and to send a letter as well. Keep the momentum going. So, some quick tips for a successful meeting. Keep the meeting to the scheduled time. If you're running late, call and let them know. Stay focused and stick to the talking points. Make it personal, make the connection, educate, and persuade. So, what can you do? On the state level, you can participate in Capital Awareness Days. These are great opportunities to bring the entire COPD community together in your state capital and raise COPD awareness with your state officials. Capital Awareness Days are opportunities to set up multiple meetings with different legislators, much like a DC lobby day, only on a smaller scale. Often, the COPD Foundation will bring the COPD shuttle so that advocates can offer rides to legislators and their staff. On the ride, they'll learn about the lungs and some of the important symptoms of COPD. And respiratory therapists are usually invited to offer free spirometry testing. This is a great chance to raise COPD awareness with the entire state capitol and make a great impact with legislators. If you're interested in hosting a Capital Awareness Day, call us here at the COPD Foundation and we'll help you set it up. The Congressional COPD Caucus is one of the most powerful allies that we have, so it's important to continually grow its membership. The caucus is a bipartisan group of policymakers committed to promoting COPD awareness and supporting policies that positively impact the COPD community. The more policymakers commit to the caucus, Then, the larger the base of representatives that we have who know about COPD, understand the issues associated with COPD, and who can help us move our key initiatives forward. Check the list at www.uscopdcoalition.org, and if you don't see your representative or senator on the list, email them through the COPD Action Center and ask them to join us. On the state level, you can help introduce and pass state proclamations and resolutions. These often announce November as COPD Awareness Month. They also recognize the issues associated with COPD and encourage spreading COPD awareness throughout the state. In 2010, over half of the nation's governors issued a COPD Awareness Proclamation. We have a template here at the COPD Foundation for proclamations and resolutions. So call on us for help if your state hasn't passed a proclamation, and we'll help you get this done. Finally, get to know your state advocacy captains. Want to get more involved with the COPD advocacy movement, but you're unsure how? You're nervous about coming to a district visit? Curious about how the Action Center works? Your state advocacy captain is there to answer any questions that you may have. They can notify you about upcoming events. They can help you navigate the tricky world of the U.S. government. And to find your COPD advocacy captain is very easy. Just surf to www.operation435.org. Interested in becoming a state advocacy captain? The COPD Foundation will provide you with an email address so that you can correspond with other advocates. The Operation 435 website will house your profile, including your name, state, and a photo, and contact information. Some of your responsibilities as a state advocacy captain will be to train and help new advocates, attend lobby events in your state, such as a Capital Awareness Day or a District Lobby Day, and coordinate other advocates for legislative campaigns. To learn more or to apply to be a state captain, you can call Amy Bolthius at the COPD Foundation. Her number is 866-731-2673, extension 459, or abolthius@copdfoundation.org. Thank you for taking the time to spend with us today and learning a little bit more about COPD advocacy and what's expected from our COPD advocates. We hope that you will join us.